Multiple myeloma is a cancer of malignant plasma cells. We all have plasma cells, and they are the antibody-producing factories. In health, these plasma cells help produce the antibodies that we all need to help fight infection. Because these cells are so active, unfortunately, they do have a tendency to go wrong, and their machinery breaks down and they become cancerous. This cancer grows in the bone marrow because that's where plasma cells live. And instead of these cells working normally, they produce the same antibody over and over again. And this antibody is something that can be measured in the blood and can be the first potential indicator that there could be a cancerous problem, such as multiple myeloma. It's getting increasingly common in the United Kingdom, and incidence has grown over the last 20 years. It's slightly commoner in men than women, and it is anticipated that the number of patients who will get myeloma over the next 20 years will also continue to grow. Approximately 6,000 people each year in the United Kingdom are diagnosed with multiple myeloma. It is a bit commoner in men than women, but it is typically a cancer of the elderly. Patients on average are diagnosed at the age of 70, and the highest number of people that are diagnosed is over the age of 85. Because we're increasingly doing blood tests for a variety of reasons now, often myeloma is picked up a little bit earlier than it has been done in previous years. The myeloma cells produce the same antibody over and over again. This is called a paraprotein. Paraproteins can easily be measured in blood tests, and sometimes the first indication that there can be a cancer is because a GP or another doctor looks for a paraprotein. The difficulty in diagnosing multiple myeloma is that virtually all patients who are diagnosed with multiple myeloma go through a precursor phase. This phase is called monoclonal gammopathy of undetermined significance, a precancerous phase where the cancer cells are producing a protein which we can measure in the blood, but the cells haven't actually become specifically malignant yet. Multiple myeloma can be completely asymptomatic. When it is asymptomatic, it is called smoldering multiple myeloma. Smoldering multiple myeloma in itself does not need treatment. It can be safely monitored because it has not been shown that treating at an asymptomatic stage is actually beneficial to patients. At the moment, the only context in which people are being treated for smoldering multiple myeloma is in the context of clinical trials. When myeloma is symptomatic, it can cause a variety what often can start off as non-specific symptoms. People can feel a little bit fatigued because myeloma causes anemia, and the symptoms of anemia can be very non-specific. Myeloma causes problems with the bones. The cancer in itself changes the balance between bone buildup and bone breakdown, and unfortunately it gets skewed towards breakdown. So what actually happens is that numerous holes can form in the bones, and this can lead to painful fractures. Of course, the problem is that skeletal pain, arthritis, back pain, these are all incredibly common symptoms. And myeloma, compared to other causes of back pain, is actually quite rare. So I think it's important that if people have non-specific pains that are not going away, myeloma is something that every doctor should think about. Other problems that can be caused by myeloma include kidney failure, and that's because in some types of myeloma, the type of proteins that are produced by the cancer can get stuck in the kidney and stop the kidney from working properly. Kidney failure can cause a huge variety of symptoms, from fatigue, nausea, general listlessness, and sometimes not being able to pass urine properly. Another symptom can be related to calcium levels in the blood going up, and that is related often to the increased breakdown of bone. Unfortunately, a raised calcium can also stop the kidney from working properly, and other non-specific symptoms of high calcium include abdominal pain, constipation, and sometimes confusion. So in summary, there are a variety of symptoms and signs that patients with myeloma can get, and like essentially most cancers, it's really important to try and get to the diagnosis as quickly as possible, so any damage to any organs can be minimized and hopefully reversed. After diagnosis, treatment isn't always necessary. If myeloma is diagnosed, but the cancer in itself is not attacking any of the organs that it normally does, the organs that can be affected by symptomatic myeloma are typically the kidneys, bone marrow failure with increasing anemia, and skeletal and back problems because of bone breakdown. If there is no evidence of any of these, and this is looked at carefully with a variety of advanced scans and blood tests, then there is no need to treat. This is called smoldering multiple myeloma. Smoldering multiple myeloma can remain indolent and asymptomatic for a number of years. Approximately 50% of patients who are diagnosed with smoldering myeloma won't need treatment 5 years after diagnosis. And after 5 years, the number of patients who do need treatment actually drops significantly. So it's very important that treatment isn't started too early or inappropriately if organs are not affected. There are 3 key approaches to monitoring multiple myeloma, and these are all used interchangeably. The simplest way of month-to-month monitoring is often with blood tests. Myeloma is a cancer that produces abnormal antibodies or fragments of antibodies. These antibody levels can easily be measured in the blood and sometimes the urine, and often once chemotherapy is started, for example, seeing the antibody levels drop is an indication that treatment is working. So this is very helpful and a non-invasive, easy way of monitoring sometimes response to treatment, and also after treatment has finished, monitoring if the cancer is becoming more active again. The bone marrow and doing bone marrow biopsies is also a way in which the level of myeloma can be monitored. Plasma cells, that are the cancer cells in myeloma, they live inside the bone marrow, and the percentage infiltration of myeloma can be looked at various time points, again, to potentially look at response to treatment and also to see if the cancer is perhaps becoming more active again. Over the last 10 or 15 years, we also have many more advanced X-ray and imaging techniques that help us monitor myeloma. Certainly an emerging technique over the last 10 years has been the use of whole body scanning, either using MRI type protocols or what we call PET-CT protocols. PET-CT involves getting structural information looking from a CT, and also biological information, because what happens in a PET-CT is that radioactive glucose is injected in. Myeloma typically takes up this radioactive glucose, so you can get a very accurate representation, potentially, if there is active myeloma in the body. What myeloma doctors do is they use a combination of blood tests, bone marrows, and scans, of course together with one of the most important things of all, which is assessment of patient symptoms and clinical examination, to accurately try and assess at each stage how active the myeloma is, if treatment is working, does treatment need to be restarted, and this is a program that is monitored moving forwards. The treatment of multiple myeloma relies specifically on 3 main themes. The first one is chemotherapeutic agents together with steroids. Chemotherapy is the backbone of multiple myeloma treatment. The aim is to kill the malignant plasma cells and stop the effects of the cancer on the body. Different combinations are often used, and there has been an amazing amount of innovation and discovery in new cancer drugs in all areas, but myeloma especially has seen a real advance, and we now have different types of agents which work in different ways and they can be combined in ways which make them much more effective. Now, unfortunately, because myeloma as a general rule is something that we can only control but not cure, it's really important that the complications of chemotherapy are minimized and quality of life is optimized. All chemotherapies can have side effects, and certainly part of the ethos of myeloma doctors is to try and make sure you get the balance between treatment working well and also minimizing the effect on quality of life where possible. The bones, unfortunately, are affected very significantly in multiple myeloma. So the second key component of myeloma treatment is what we call bone protection. In myeloma, unfortunately, bone is broken down much quicker than it's built up. This causes fractures and high calcium, and these things can have very significant impacts on the body. So we typically use drugs called bisphosphonates, which have been used for decades in multiple myeloma and even longer in conditions like osteoporosis. These drugs are extremely important. They're typically given about once a month, and what they do is they redress that balance between bone buildup and bone breakdown. The third component of treatment, which is sometimes used in myeloma, is radiotherapy. Now, radiotherapy is used in only very specific circumstances in myeloma, and this is typically related to areas of pain that are caused by the disease that are not responsive to other strategies.